morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. I'm Paul Thomas, he's Bill Kearney. We do this every Wednesday, and welcome again to Health Talk. Bill, what's going on in your neck of the woods?
Well, summer's coming. That's for
sure.
We're going to have a big change, I guess, starting today and
weather-wise,
working up to the weekend, and of course we're right in the middle of all that. I'd like to remind everybody that we've had a change of management at North Lake Medical Pharmacy at Bruno's, and to kick that off, we're having a gift sale. 25 to 50% off gifts that are marked in the store. A lot of inventory that we're trying to move out of there, and so we'd like to take this opportunity to let everybody know. We think about North Lake Medical Pharmacies as medical suppliers and taking care of our customers, but we also have to make a little bit of profit along the way, and we have quite a supply of gift items that we're trying to turn over and get some other items in there that will be a little more attractive to the consumer. So just want everybody to know it's posted in the store. You won't see an advertisement except hearing it on KXBX, my favorite source of advertising, and we're looking forward to that, as well as the concerts in the park coming up this Friday for the first time, Paul.
Yeah, and a big announcement to all of our listeners. Different this year is the start time. We've actually moved it up to 6 o'clock instead of 6:30. So get out there early. I expect it's going to be a great week with the weather, and we've got a good band, the Johnny Young Band, I believe they're out of Ukiah. And so we're excited to get it kicked off, and it's it's a long 10 weeks for us that work it, but where else can you go and get free entertainment like you can for the concerts in the park?
Well, those of us who party, it's a long 10 weeks too, and we're sponsoring August the 4th, so
yeah, you guys get Rigney, Tom Rigney, Flambeau is always a good one.
I wasn't going to be here. I was going to be on a fishing trip, and the weather's going to be so bad out there that the boat can't go out, so we will be there. But
that's this weekend you were going to go fishing?
Yeah.
Oh, no, really?
A friend of ours takes a boat out every Friday, and he called me last night and said the boat was stuck in Bodega Bay. The winds were so high they couldn't get back.
Oh, wow.
And it was going to be a bad day on Friday to go out. So I normally don't do that. Fridays is supposed to be my day off, and I seldom take it, but this was an opportunity to lock myself into something else, and it just didn't work out. So anyway, I would have missed the concerts in the park, and we have a full schedule of things going on, so it's kind of exciting to get the boat out and come across the lake. I'd have to do it a little bit earlier, so maybe I won't have to work as late.
Also just a heads up for all of our listeners, due to the recent storms, there is storm damage down at the park still. So part of the park, the promenade, I guess is what they call it, will be closed off, but you still have access to the main dock there. Through the middle of the park, so if you're bringing your boats over, you'll still be able to moor your boats on the docks and all that. And they're supposed to have the 3rd Street boat ramp launch open as well, but it looks like last time I saw it was still hung up. So, hopefully they'll get that open. But just be aware that part of the park still is going to be closed off. That main walkway right there by where the water is.
Well, as you know, I wear many hats in this community, and along that line of thinking, I was on an economic development committee meeting with the Chamber of Commerce last Thursday, and it was brought to our attention that due to the state law that was passed about protecting the hitch, that people would not be allowed to put in pilings to fix their docks from the storm, and if they did, it was a $5,000 to $7,000 permit fee.
Wow! And
it would take 6 months to get it okayed, and then it would only be from October to December that they could go through that process.
Wow!
That's going to lower the value of all the homes along the lake. You will not be able to put in a new a new pier if you buy a home without one. And if you want to stop progress completely in this county, that's the way to do it, county. That's the way to do it, planning commission. That's the way to handle it. Just stop everything. And you know I'm not a fan of the county helping individual business people out anyway when it comes to either health care or the planning has always been a problem. So if you have a problem with what I'm saying, don't call this radio station. You can call me at the pharmacy, and I'll be more than happy to share that information. And if you have more correct information for me, that would be a pleasure for me to give to the people who have property on the lake or people who had damage on the lake to their piers and they can't put any new pilings in to rectify that damage. Well, now we're going to get on health care. And I hate to start out the health topic every year or every week by the same thing, but this issue of people going over the hill when it comes to deaths of opiates it continues to be a huge issue, and there continues to be more and more of those. The number of deaths has increased 19% since 2015. It also represents the largest year-over-year increase ever recorded in the United States of people who died of drug overdoses. It was nearly 60,000 people. Shocking, it really shouldn't be. There was an editorial in the Press Democrat on Sunday because there's a huge crisis in addictions, compounding the use of synthetic drugs such as fentanyl, and then forms of fentanyl in other doses that are 50 to 500 times stronger. During one-day period in April alone, 5 people, 3 women and 2 men, all between the ages of 25 and 66. Now, you think I'm quoting this from the New York Times? That was in Santa Rosa area, died. 5 people in April, 25 to 66, died of overdose of heroin. Officials have issued a warning that particularly potent batch of drug could be in circulation on the street. If it's in Santa Rosa, it's in Lake County. And if you think heroin is not in Lake County, you're strongly, strongly wrong about that. The epidemic is far-searching. County officials said that opiate abuse was contributed factor to sudden 17% increase in the number of child abuse or neglect cases recorded last year. We're talking about Sonoma County. So of the 2,200 cases investigated by Child Protective Services, drug and alcohol abuse were a factor in 42%. You know, Sonoma County has been very active in the community of welfare participants and Medi-Cal participants and Partnership Health in trying to educate our patients on what the danger is here and what to do. And you think about the people that are just down and out drug addicts, and then you think about, well, there are a lot of people that we know that are legitimately taking these kind of drugs, and it came into the limelight here on Memorial Day when Tiger Woods was arrested for taking being under the influence, and he kind of stumbled. If you've seen the YouTubes and official reports of his apprehension and his incarceration, it is brought to light that a lot of people are probably taking a lot more of these drugs than you think about, and the law enforcement now is going to, as we briefly talked about last week, is going to take an active part in trying to test for these kind of medications. When he was arrested. He gave 4 medications. 2 of them we didn't even know what were. According to the National Highway Traffic Safety Administration, in the last 2 decades, while the overall number of annual traffic fatalities has trended downward, was nearly 36,000 in '93. In 2015, it was only 32,000. That's a lot of people. The number of those involving drugs has sharply increased. There were around 1,700 cases in 1993 compared to more than 6,600 in 2015. More states having some form of legalized marijuana as part of it. The national opioid epidemic is another one. At the scene when Tiger Woods was arrested, he had undergone 4 spinal surgeries, which I have done also. And he had prescriptions for multiple medications. The first 2, one was Torex and Vioxx. We assume the Torex was Toradol, but it was from another country. And Vioxx, which is a banned anti-inflammatory that was banned since 2004, is not even in this country anymore. And Vicodin, which is the same as Norco, and Solarex, which is from outside the United States, has no formula that we're aware of in the United States, and no pharmacology experts have been able to identify it. So a lot of people now are living longer. Also, often when people are prescribed pain-killing medication, they're also prescribed a muscle relaxer and an anti-anxiety medication, such as Valium. Let me relate to you an incident, a real live incident that happened to me. I can't remember if it was this week or last week. I think it was this week. I had a patient that was going to a physician who had since closed his practice or her practice, and had been prescribing opiates for this patient as well as muscle relaxants or anxiety medication. Because the physician was no longer going to be able to write prescriptions for some of the pain medications, it was suggested that she taper off some of the pain medications, or he, and said nothing about the anti-anxiety medications. Now, anti-anxiety medications such as Valium, Xanax, Ativan, the like of those are what we call benzodiazepines. It is far easier to withdraw from an opiate medication, even though it's not a happy thing. It's much easier to stop taking that drug. On a benzodiazepine, such as something for anxiety, and also can be used for muscle relaxant, it is much more difficult. The withdrawal from benzodiazepines is lengthy for most people. You do not want to stop taking it cold turkey. You will go into a withdrawal that is far times longer and more difficult than the one you did on Norco or Vicodin. Almost everybody that I've talked to that has withdrawn from an opiate has felt better afterwards, and you're going to see more and more of that kind of withdrawal going on because of the federal influence on opiate addiction. Most of those patients are also taking a benzodiazepine. For some reason, physicians are reluctant to tell you that this could be as much as a 3-year withdrawal from this drug. I happen to have a brother-in-law who was in the Secret Service when President Ford was the president, and Betty Ford, which now has a clinic down in Palm Springs, or the Palm Springs area, had an addiction to a benzodiazepine called Valium. And my brother-in-law, who was her Secret Service agent, had to go through the process with her. It was not an easy withdrawal, not an easy process. In other words, it's one of the potential risks that's been seen with people who are on painkillers, and when they try to withdraw off these drugs, all they supposedly do is keep you calm from having anxiety attacks. If you just stop taking this drug, you're going to be in trouble. They're often very powerfully fast-acting. The opiates are more fast-acting than the benzodiazepines, but taking them too closely together can give a potential for negative reactions. So if, in fact, that you're in this category, be sure your doctors and pharmacists know all the medications you're taking so you can avoid hazardous narcotic and benzodiazepine reactions. I never would have known, even though this patient called me about not being able to get the benzodiazepine, I would never have known that this was something that she'd been on for a long period of time, and the doctor had not given him or her any instructions to withdraw from it. The first few times, if you get a medication like this, and I was just talking to somebody last night that was going into surgery for a broken limb, and I was telling the patient how to be careful with it, and that eventually they would probably write a refill for it, and not to get dependent on it. Now, the doctor, where in the old days they would give you 60 or 100, they gave this patient only 30, and they will counsel that patient when they get out of surgery. For pain relief, always take the lowest powerful medication first and see if that works. If you can utilize other non-pharmaceutical modalities for relieving pain or anxiety, options for reducing pain without pills can include high-intensity laser, physical therapy, PRP, which was platelet-rich plasma, stem cell therapy, and other kinds of interventions. For anxiety reduction, mental health counseling, yoga, breathing exercises, visualization, and and meditation. And I'm giving you these things like these are simple things to do. I have done most all of them. The next surgery that I'm supposed to have is to replace a torn meniscus. I wanted to do PRP, which was plasma-rich or protein-rich plasma. My orthopedic surgeon said I wasn't a candidate for that in this particular situation, and I have elected not to do the surgery. Am I in pain? Yeah, I'm in pain, but I've been in pain for a good amount of my life. Do I take pain medication? No. I take an anti-inflammatory to keep the inflammation down, and it benefits me. Without doing that, I couldn't even hold a pen in my hand or barely walk. With an anti-inflammatory, and this is not cortisone, this is Celebrex or Siloxybib, it gets the pain now down enough that I can go to work. So I just want to remind you that as I did this patient, we have to become, and as I do every day that I'm on the air, you have to be the healthcare provider for yourself. You have to decide how important this is. You have to ask the questions, and if you don't feel like you can ask the questions from your physician, ask the question from your pharmacist. Even if you don't get your prescription from us and you feel reluctant to go to your regular pharmacy, give us a call or come in, and we will help you out. We have to be careful because of liability procedures, and we don't know all the medications you're taking unless you do. But it's important for us to know your whole scope of a business when it comes to health care. And it's kind of a sad thing that we're getting into right now as far as how do we take care of ourselves. And it's harder and harder to find a physician in Lake County that will take more patients because most of them are going into clinics, and very few of them are opening private practices. Why is that? The reason is that it's not cost effective for them anymore, and working for somebody else 9 to 5 will really be an opportunity that would probably pay them the same amount of money, if not more, and not have the responsibility of having to be on call 24 hours a day, 7 days a week, as I did the first 25 years that I came up here. So it's a crisis in healthcare. It's a crisis that needs to get fixed. You can badmouth the Republican program as much as you want. Likewise, you can badmouth Obamacare program as much as you want, because by the time the other program gets into effect, Obamacare, most of the third-party payers will abandon Obamacare because they can't survive either, and it becomes something that it's awfully difficult to deal with. Along that way, most of you know that have listened to my show that I had colon cancer several years ago. And I just saw a thing that came on NBC today about 6 colon cancer warning signs that you're never to ignore. Probably the most common warning sign is rectal bleeding. Now, saying that, albeit it could be hemorrhoids or something similar to that, but if you notice a lot of blood on the toilet paper and the toilet bowl or mixed in your stool, it can be bright red or a dark maroon color. It would generally be more significant bleeding that's caused by hemorrhoids or a cut in the area. A lot of people don't look at their stool, and so it's important to look and see it's important to what's going on. That's how mine was discovered. Rectal bleeding is something, believe it or not, people can ignore for long periods of time. It can be intermittent, so you might have it one day and it'll go away the next. And then you'll get it again. So in between, you'll think you're okay, but you may not be. So that's the number one sign that there could be something wrong. When you start bleeding, you can have other side effects, and iron deficiency anemia is one that when cancer tumors bleed, that causes iron loss in your body, because iron is stored in your red blood cells. And people may not be aware that they're losing blood, but a routine blood test will reveal what your hemoglobin is, what your total blood count is, and not having enough healthy red blood cells. Abdominal pain that's constant. A tumor could cause a blockage or a tear, causing cramps and other pain. The type of discomfort that you might experience could either be dull or sharp. It depends what's going on. If it's dull and continuous, you still need to address it. Pain may be a sign that things can't pass through also, so you may also experience nausea and vomitings from the distension from the stomach. Narrow stools. Doctors refer to this as a change in your stool caliber. If they're thinner than before, that may suggest a tumor in the colon where the volume for it to go out through your intestinal system is much smaller, so it makes the stool smaller. And if you have the feeling you have to empty your bowels, and then when you do, nothing happens, that can also be caused by a tumor in your rectum. And then an unexplained weight loss. This is always a reason to consider colon cancer or any cancer in general. I think I related to you last week or the week before. I went out on Memorial Day weekend in the boat, and I wasn't drinking enough fluid, which I wasn't aware of at the time. I thought I was, but it was pretty warm. And I got back in that day, and I had lost 8 pounds in a day. And I got on another scale and saw the same thing, and I figured out that I was dehydrated. So just because you're losing weight like that in one day doesn't mean you have cancer. But if it's a continual process of eating about the same thing and still continuing to lose weight, that's one of the signs. You think you're eating enough, but the disease can change the way that your body uses their food. So, and it prevents you from being able to absorb all the nutrients. And other diseases can do that also. So celiac disease is another one that the oil when you have celiac disease keeps you from absorbing vitamins and nutrients. So you wonder when you should start getting screening if you're at an average risk for developing colon cancer earlier. Both of my grandparents on my father's side died of colon cancer 3 months apart. It has a huge impact on reducing the number of colon cancer cases. I for one, I thought it was, I guess it was 13 years ago, and I've had one reoccurrence since, and I'm doing okay. We're going to take a break. When we come back, we're going to talk about vaccines, how there's more patients that need to get vaccines that are already, and people that are having vision problems and causes them to have medication errors. Springtime. The sun shines, the bees buzz, and for millions of Americans, it's time to lock all the windows, blast the air conditioner, and hope that wonderful air filled with pollen never makes its way indoors. Hi, I'm Bill Kearney, pharmacist and owner of Northlake Medical Pharmacy. According to a national survey, 80% of the people interviewed said their allergy symptoms disrupt their lives. There's no reason to let allergies disrupt your life, and there are many preventatives and treatment options. Pollen probably won't kill you, but asthmatics and people with compromised respiratory systems are warned to take precautions when pollen counts are high. So over-the-counter remedies provide adequate relief for many sufferers, and most prescribed antihistamines will provide the same degree of effectiveness. So if you're suffering from seasonal allergies, stop by Northlake Medical Pharmacy and talk to our knowledgeable staff about your allergy symptoms. Find out what medication is right for you. Northlake Medical Pharmacy is with 2 locations to serve you, at Hill Road next to Sutter Lakeside Hospital and outside Bruno's Shop Smart at 347 Lakeport Boulevard.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, June 9th. In Lake County on Route 20 near Mitchell Road, expect 5-minute delays weekdays. On Route 29 near Bar X and Bottle Rock Road, expect 15-minute delays weekdays. And on Route 175 near Forest Lake Road, expect 15-minute delays. In Mendocino County, on Route 1 near Ocean View Drive and South Beach Access Road, also near the Wages Creek Bridge, expect 5-minute delays. On Route 20 near Road A, expect 5-minute delays weekdays. On Highway 101 near Leggett, expect 20-minute delays. On Route 128 west of Yorkville, expect 5-minute delays. On Route 162 near Pukini, expect a 5 and 10-minute delay. On 175 near the 101 Junction, expect 5-minute delays weekdays, and east of Buckman Drive, expect 30-minute delays. Finally, on Route 253 near Singley Cattle Pass, expect 15-minute delays weekdays. Like us on Facebook for more updates. That's Caltrans, District 1.
The Lake Family Resource Center Early Head Start is a federally funded program that provides many services and resources to low-income families with children ages 0 to 3 and expectant mothers, and includes comprehensive child development programs, prenatal education, links to birthing classes, parent involvement activities, family fun days, and comprehensive family services. The Lake Family Resource Center Early Head Start program welcomes families from all cultural backgrounds to participate, including families with children who have special needs. Call 279-0563.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you. Lake County Chamber of Commerce, join today, it pays to belong.
The Lake County Chamber of Commerce would like to recognize the Member of the Month, Orchid Realty. Sam Orchid, broker-owner, has been in business for over 40 years in Napa and Lake Counties, and his expertise will benefit you in buying your next home. For your next real estate transaction, call 486-1646.
Lake County Chamber of Commerce, join today, it pays to belong. Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
Okay, we're back.
Well, just before we...
Sorry for the delay.
Yeah, sorry for when we broke for the break. Again, our number is 263-5252. If you have any questions about anything we're talking about, give us a call. Again, 263-5252. We talked a little bit about vaccines as we do every week. For example, only about 30% of the patients who are candidates for shingles vaccine report receiving it. Now, shingles is a viral disease that there's only one thing for, and that's the shot. And many patients age 60 and older may need a shingles vaccine, and many now at 50, the company who makes Zostavax, Merck Sharp and Dohme, said they should start getting it at age 50. And of course, if you're over 65, you need the pneumonia shot also. And there's two pneumonia shots. There's the Prevnar 13 and Pneumovax 23. So when we were going through our medical therapy management, for instance, with most everybody with diabetes should get flu shots, pneumonia shots, hepatitis B, partly because they have a higher risk for complications from these infections. And then people getting an inhaler for asthma or COPD may need a pneumococcal vaccine. And pregnant women, and we mentioned this on the air last week, and some people listened to me, and we did some extra Tdap shots, which is for people who are getting whooping cough. So every time a female is pregnant, she has to get a Tdap shot, even if it's right after she gets pregnant, right after her last pregnancy, and it gives the baby 6 months worth of immunity. If you have a child or a grandchild that's having a baby, and you as an adult, no matter what your age is, need to get a Tdap shot, which will help you against tetanus, diphtheria, and pertussis, which is whooping cough. We have to start being proactive in this to try to get people going. Especially when it comes to the elderly people, if you get shingles right now, it can be the most painful thing that you've ever had in your life, because it will either be in your hair, your eyes, around your breasts, on your arm, and if this continues to go on, it develops open sores on your skin with the nerve endings of those nerves exposed. There's no sheath over those nerves. It's like having a million root canals at one time. Air on your skin can cause you to go into orbit for pain. Nothing will stop that pain because it's nerve pain. If you get the diagnosis early, you can get some sort of an antiviral oral medication that will help you take care of that. If you're on Medicare B, it usually covers flu, pneumococcal vaccines, and hepatitis D. Or hepatitis B. Part D plans may cover shingles and other vaccines. Many other payers cover vaccines that we give at the pharmacy. And I'll tell you why they do at the pharmacy, because you don't have to pay for a physician's appointment in order to get the immunization. So you may need to talk about it a little bit with your significant other or your husband or wife and find out whether or not you think it's worth it. Right now, there's about a 60 to 80%, almost 80%, which is better than the flu vaccine. Last year, the flu vaccine was only 48%. But if you can keep half of the people from going to the hospital, you're doing a good job. In the case of shingles, it's half the people out of a really bad pain, which if you don't get it quick enough, I have a sister now that's had it 6 years, has had a stroke because of it, and cannot get the virus out of her system enough to get a shot for the shingles. You don't want to get in that kind of position. So just reminding you to keep that in the back of your head. We have it all the time. We keep not the flu vaccine because that is seasonal, but for hepatitis B and for whooping cough and for tetanus and pneumonia, those are injections that we give all the time. You don't need a prescription from your physician. Just come in and tell us that you want the shot. Give us your insurance. We'll try to run it through. They're becoming more and more liberal, insurance companies are, about paying for immunizations because in the bottom line, it saves them a lot of money. So just remember that it's worth a shot. We can run it through, and if it doesn't, we'll tell you how much it costs, and you're under no obligation to get that medication. The one that we don't give until we know it goes through your insurance or that you're going to pay is the Zostavax, the one for shingles, because that costs us $220. It comes as a frozen vaccine, and when we give it, when we mix it, we have to mix it ahead of time. It's only good for 30 minutes, and then we have to throw it away. So we can't afford to do that. Our profit on it is quite small to start with, and we're probably the lowest price of anybody in pharmacies for if you had to pay for it. So,
Bill, we got a call.
Okay.
Let's get this teed up here. We haven't had one in so long. Let's see. Good morning. You're on Health Talk.
Yeah, I had the shingles vaccine 10 years ago. Do you need to renew it or get a second one, or is that good for life?
Well, that's an excellent question. It isn't good for life, but they do not recommend getting a booster shot as of yet. I got it at the same time, and it was only supposed to be good for 8 years. We're going on 10 years. They are developing another one that should be out by the end of the year. I don't know whether it will or not, but I wouldn't worry about it right now. There's nothing available, and they don't suggest you getting another one on top of that, because I have called the company that manufactures that, and that's what they told me as little as 2 weeks ago. So very good question. Just hang on.
Thank you very much.
All right, thank you. Along with that answer, a lot of people are concerned about shingles being you being able to contact shingles and being transferred from one patient to the other. The only way that can happen is if you're taking care of a patient or a friend or a relative that has that rash and it's oozing out of that rash, and you get that on you, you can certainly pick up shingles from that rash. That doesn't mean you're going to, but that's the only way it can be transferred. So just avoid that rash. If you're putting something on the rash from somebody that you're taking care of, use gloves, protect yourself, and just don't get it on yourself. Briefly, just before we broke, we were talking about some vision problems and how that can lead to problems with people taking medications. People that have vision problems that limit their ability to read or understand their medical information are at a high risk for making med errors, as taking the wrong drug and at the wrong dose or the wrong time. And you don't necessarily know who those people are. Lots of times they will come in wearing glasses, and then as soon as they walk away from the counter, they'll take their glasses out. And whenever there's a new prescription, the law requires us to give you a, excuse me, a patient insert that tells you all about the side effects of the medication, as well as when we give you an immunization. So we try to keep the inserts, the printer cartridges really sharp so you can read them. We can, the law requires us to have a font setting on your label that's big enough that you can read, plus the prescription number is highlighted. Some pharmacies even offer talking prescription bottles. Target used to do that. Target pharmacies no longer exist. It's CVS within the Target stores. Whether or not they do that or not, it's quite pricey for them to do it, and they may have discontinued doing that. Magnifying glasses or clip-on to insulin syringes, blood pressure and blood glucose monitors that give audio results rather than looking at a screen. People that don't remember whether they've taken their pills or not, set up a pill box. Believe me, I take medication once a day at 4:30 or 5 in the morning. And then I'm busy on the computer doing things, 3 or 4 hours worth of work before I go to the pharmacy. And sometimes I don't remember whether I took my medication or not because it's the first thing I do when I get up. But I have a pill box that's 7 days, and I put all the pills in one section. And we also sell pill boxes that divide it into 4 different boxes for a day's supply, and will carry a week at one time. So don't be afraid to ask to purchase one of these. And if you really want to make sure that you account for this, we have blister packs. Blister packs are cardboard containers that are have 31 slots in them, and we heat seal them. And we can make one for morning, noon, evening, and bedtime if you're taking it 4 times a day, and you go by the calendar day. So, and we have a label that goes on the front of it that tells you how many pills or what date that you're in. And so if you started on today, it would be the 14th of June, Flag Day. Get your flags up, please. And then on the 14th at morning time, you take it. The 14th, the next card is the 14th at noon. The next card is the 14th at bedtime, and the next one is 14 or at dinner, and then 14 at bedtime. So, and we do that for you. So keep in mind that there's ways for us to do that and help you keep from making errors on some of these medications. Now, we're required by the different insurance companies to go through your medications, and I've been doing that since my manager left in reviewing a lot of your medications, and especially ones on Caremark by SilverScript and Aetna and Humana. The other day I was reviewing a patient that was on multiple medications, and they hadn't gotten their prescriptions for maintenance medications filled for 3 weeks. I assumed incorrectly that that patient had gone someplace else because I couldn't imagine them being that late on getting their prescription filled. Lo and behold, and so I reported to the insurance company, no longer comes to this pharmacy. Lo and behold, 3 weeks late, the patient comes in, and yesterday, and we fill the prescriptions again. Now, the insurance company pays for it, but they're not happy if we don't address the issue with them when they're late. So we're doing this on your behalf, so they will continue to give you your medication for a small copay. If they don't, then it's usually because something else is going on. Now, we have people that I know as a patient have been in the hospital or been in a skilled nursing home to get better, but they're not going to be in skilled nursing home the rest of their life. And when we know that, we tell the insurance company that's why we haven't been, or they're on hospice, and sometimes hospice is taking care of that. So just be aware we might be calling you, and sometimes we give them incorrect information if we don't know why. So if you're due to have your prescriptions filled, please let us know why you didn't if you're still continuing to come to us. We don't have any idea at the time what's going on and whether or not you're still one of our patients until after we've sent the report in. There's a drug called Ketorolac, and that's one of the drugs that we think Tiger Woods was taking, and it's a non-steroidal anti-inflammatory. Toradol is its brand name. And we used this a lot when we were doing the jail because it isn't a narcotic, and it's used for acute pain. The name is Toradol or Ketorolac. It's used in emergency procedures. It often works as well as an opioid, and the injectable can be used in patients who don't take an oral non-steroidal anti-inflammatory. Now, we see abuses with this drug all the time. We don't dispense a lot of it, but and that doesn't mean Ketorolac is stronger than other non-steroidal anti-inflammatories. In fact, ibuprofen 4 or 800 milligram or naproxen 500 to 550 milligrams seems to work as well. And there's a really high risk with Toradol or Ketorolac of gastrointestinal bleeding and possibly kidney problems, especially with higher doses or a longer duration. Now, the prescribed way of handling this, the standard of practice was recommending using, limiting the use of this for acute pain. If we get a prescription for that, it's supposed to be limited to just one 5-day course. So that would be 2 or 3 times a day, and then switching to a different non-steroidal anti-inflammatory. There's a high chance of an allergy happening. There is a high chance of gastrointestinal bleeding or kidney failure. So we used to use it all the time for prisoners because they couldn't get high from it, and it wasn't an opiate. So there's also a nasal spray. It doesn't have any advantages over other forms, but it costs more, as you will see is happening all through the medical field. I just had a board meeting this morning, my 5 o'clock meeting, and we talked about the cost of medications and how brand names are continuing to escalate and how generics are continuing to deflate in price. They expect that to go in another direction because that's what happens from time to time, and we're kind of hoping. I had a prescription from a dermatologist that I bought 2 years ago for it cost me a $5 copay. It was a $151 copay. The same thing, not a new drug, not anything that should have gone up in price. They just became the only provider, and we're having that happen right now with naproxen or naproxen. The generic form of the prescription, 500 milligram or 550, there's only become one manufacturer. We assume that price is going to go up as well. And the pharmacy benefit managers and the insurance companies seem to know way ahead of time when this is going to happen and raise your copay. So if that happens to you, there's a chance we can get you, your physician, to prescribe a different non-steroidal anti-inflammatory to replace that one. 263-5252, 263-5252 if you want to talk to us about anything we're talking about. PPIs, which we've talked about a lot in the last 6 months, almost as much as we have statins. You'll see more focus, and these are the things that keep you from getting ulcers. Omeprazole is the primary example, and there are more of them on the market. So Prevacid is another one, and they are having side effects, and many patients use them longer than they need to. Chronic use is close to causing compression fractures, C. diff, pneumonia. You need to take it safely and an exit plan to stop it if it's no longer needed. I had informed you a month or so ago that I was on this this medication. Protonix is the one that I was taking because of having colon cancer, and it is prompted many times by an acidic value, your gastrointestinal system or your stomach and intestines as being highly acidic. And my gastroenterologist at the time said, I want you to take this the rest of your life. Now, I don't know whether I need to or I don't need to. I'm going back. My gastroenterologist has since left I'm going to another one in a few months, as it'll be 5 years since I've had my last colonoscopy. And at that point, I will ask them whether or not I should still continue to take it. When potential benefits such as that outweigh the risks, we always go with that risk versus benefit thing. And a lot of people who are taking antacids, as I am, you're getting all my my protocol here for all the medicines I take. Those antacids or anti-inflammatories can cause a induced ulcer from them and a GI bleed, and so when you're on both of those things, and I know both of those things are risks. Anti-inflammatories are risks for an increased chance of a heart attack. PPIs are a risk for to keep you from getting C. diff or fractures. And C. diff, for those of you who don't know what it is, it's a highly infused kind of diarrhea that is highly contagious. And many times people in long-term care facilities get it. Many times people in acute care facilities get it. And they have to kind of be quarantined to and gown up when they go in there to keep it from being passed on, because it can be very epidemic in proportion. So if you're put on a PPI like omeprazole or Protonix or Prevacid, such as maybe 4 weeks for a duodenal ulcer or 8 weeks for a gastric ulcer, also check that it was used in the hospital to prevent stress ulcers on your body when you're bedbound. We reduce the dose sometimes from 20 milligrams twice a day to once a day for a week or more, and then extended it to every other day. And that's the same pattern we use if we're trying to withdraw you. There are a lot of drugs that you just can't cold turkey from. And it's always safe to ask your pharmacist if you can quit taking it, if your physician asks you to, if you can cold turkey it, or do I have to taper it off? Well, in the case of a lot of blood pressure medications, some of the statins, a lot of not so much antibiotics, but other things that affect the endocrine system or affect the gastrointestinal system or the respiratory system, you need to taper off of it slowly. And why is that? It's because your body is used to responding to that medication when it gets into your system. And when it's not there, even though it's not putting you in a fatal reaction, your body reacts by, where is it? Why isn't it working? Antidepressants are the same thing. If you're on a serotonin reuptake inhibitor, any kind of a antidepressant, never, ever stop taking it abruptly. Taper yourself off. If you don't know how to do that, ask your pharmacist. We'll be more than happy to tell you. One other little side note about medications. We always talk about when you're taking statins not to take grapefruit juice and many other drugs when you're taking, because it prolongs the activity of the active medication that you're taking. So if you're taking atorvastatin or lovastatin or pravastatin, any of those statins, and you take it with grapefruit juice, it's liable to increase the activity of that medication. Now, we just recently found out, and I usually don't report on this, but I thought it was substantial, even though the study was small. I can't tell you exactly right now what the medication was, but we added grapefruit juice to a medication that was having trouble bringing it up to the level where it was pharmaceutically effective. And we added grapefruit juice to this regimen. The addition of the grapefruit juice, which interfered with the metabolic breakdown of the breakdown in the body of that medication, allowed the medication to reach a higher level where it became pharmaceutically effective. So we're looking at adding those kind of things to medications now to see if a drug that wasn't effective before is now effective when it comes to giving it with grapefruit juice instead of just giving it on its own. And it may make the use of this more effective. Now we're getting into what we called, and we're running out of time, I was going to do a thing on unlabeled uses of drugs and what that can amount to. And in situations like this where a drug has been approved for something else, and now it's used for example, take beta blockers, for example, to add a beta blocker to a medication, and maybe it's not effective at that dose, and you increase the dose, but it's an unlabeled use for a beta blocker is anti-anxiety. As we were talking about this patient who was on a benzodiazepine and was on for anxiety, there is a chance that they could go on a beta blocker, which is or a antidepressant that has some of those possibilities, and take care of the anxiety, and it would be an unlabeled use, meaning the FDA did not clear that drug to be used for anxiety, but it's being used effectively for anxiety. So there are other drugs throughout the system where we use a lot of anti-inflammatories for menstrual cramps. We use a lot of drugs that were meant to be used for different reasons, for completely new reasons that haven't been approved by the Food and Drug Administration. For example, statins are used as an anti-inflammatory for aneurysms. We have many people that have died of sudden death if they weren't on a statin where they got an embolism or an aneurysm, and there was nothing they could do to keep the inflammation down. And as you would look through the artery or the vein, that would look clear. But above that artery would be that embolism or that aneurysm that was swollen, and the use of a statin would have prevented that. Whether or not it's enough to get the embolism or aneurysm down once it starts is determinable, but we don't know about that yet. We are going to remind you that summer is starting, school's going to be out, people are going on vacation, it's going to be hot. People are going to get sunburn, people are going to get sunstroke, people are going to get hurt themselves, and no matter how much we tell you, you're going to be some of those people that go out there when you don't think there's a danger and there is a danger and need to be taken care of. So remember about our gifts that are on sale. As we speak, go into our pharmacy. We also have Dr. Comfort boots are on sale at a discount from the winter time, and remember also that we deliver free for your prescriptions. I'd like to remind you that we're North Lake Medical Pharmacy with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart, give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday for Health Talk right here on AM 1270 and 96.5 FM. KXBX Lakeport. See you Friday, 6 p.m.
I'll be there.